Okay, good afternoon, everyone. Thank you for joining us on today's webinar showcasing the project highlights from the most recent round of ASTHO's Environmental Public Health Tracking Fellowship Program. For those of you who don't know, my name is Samantha Williams, and I'm a senior analyst on ASTHO's environmental health team. And today I'm really excited to share with you how our long-standing partnership with CDC has created some unique opportunities for health departments to build capacity for tracking in their states and territories. I'd like to just briefly introduce ASTHO for all of you who aren't too familiar with our work. We are the national nonprofit organization representing public health agencies in the United States, the U.S. territories, and the District of Columbia, as well as the over 100,000 public health professionals that the agencies employ. So in addition to the work that we do directly with our members, programmatic staff such as myself participate in a number of federally funded projects where we help state and territorial health agencies develop and implement policies and programs in public health priority areas. And we are headquartered in Arlington, Virginia. So what is environmental public health tracking? And what are we talking about when we talk about environmental public health tracking? Essentially, it's a type of surveillance that involves the ongoing collection and analysis of data to discover trends and patterns of disease, environmental hazards, and exposures that can inform successful public health interventions and policies. The tracking network includes data about health conditions and diseases, environmental contaminants, climate, community design, and population characteristics. This data is provided by state health agencies that are funded by CDC's programs to collect and share data. And you will learn a little bit more about CDC's programs shortly. The CDC provides grants to 26 state and local health departments to monitor hazards and collect and submit data to the national network. Back in 2008, ASTHO partnered with CDC to provide unfunded states with an opportunity to build tracking capacity and help to close the gap that exists across the national tracking network. So through the fellowship, every year, ASTHO accepts 3 to 4 state or territorial health agencies into the program. Each fellow proposes and undertakes an environmental health pilot project of their choosing that they conduct over a period of about 6 months. ASTHO matches each fellow with a CDC-funded tracking team who provides the fellow with guidance throughout the project period. ASTHO fellows receive a travel scholarship, which they use to visit their mentor team's health agency on a 1 to 2 day site visit. On the site visit, they cover a range of topics, including program management, portal development, communication, and outreach. The fellowship concludes with the submission of a short report documenting the project outcomes and experience. And these are all available on ASTHO's website. So to date, you can see on the right-hand side of the slide some of the key numbers of the program. To date, we have supported 43 unique fellowship projects. And what's great is that we've seen 5 former fellows successfully join CDC's National Tracking Network. So in 2017 and 2018, ASTHO accepted fellows from 4 health agencies: the Commonwealth of the Northern Mariana Islands, Pennsylvania, Alabama, and North Carolina. And you can see them all here circled in red on the map. They were mentored by the CDC-funded states of Washington, Colorado, Alabama, and New York State. And finally, to our presenters. So today you will be hearing about 3 of the 4 fellowship projects from 2 of our fellows and from 1 of the CDC mentor teams who will be presenting on behalf of her fellow. Our first fellow that will be presenting is Dr. Anil Nair, fellow from the Pennsylvania Department of Health, where he is the director of the Division of Environmental Health Epidemiology at the Bureau of Epidemiology. Next, you will hear from Tim Hatch, fellow from the Alabama Department of Public Health, where he serves as the health administrator. And finally, you will hear from Tina Echeverria, program manager for Washington State's Environmental Public Health Tracking Program and mentor for our fellow from the Commonwealth of the Northern Mariana Islands. Tina has previously participated in mentoring 2 ASTHO fellowships, but was excited for her team to be asked to mentor a territory. She will be presenting on how Washington met the Commonwealth of the Northern Mariana Islands' unique needs through a reverse site visit experience. But first, I would like to welcome Dr. Phuyen Yip, Section Chief of CDC's Environmental Public Health Tracking Branch, to share a few brief remarks on the tracking program. And before that, I just wanted to let everyone know that we will be taking questions for all presenters following the presentations. And you can feel free to type questions into the chat box or ask questions on the line upon the conclusion of the presentations. So thank you, Phuyen.
Great. Thank you so much. And thank you, everyone. I'm really excited to have the opportunity to briefly provide an overview of our tracking program with you today. Next slide, please. So our tracking program began 16 years ago in response to the Pew Environmental Health Commission report that called for the creation of a nationwide tracking network, a health tracking network, to highlight relationships between chronic diseases and the environment. Next slide, please. And so the vision of our program is to be able to translate environmental and public health data into meaningful information that can result in healthy communities. And to be able to achieve this, our mission is to bring together environmental hazard, exposure, and health data, as you can see in the figure on the right, onto one data platform to help drive public health actions. Next slide, please. And the Environmental Public Health Tracking Network is the cornerstone of our tracking program. It's a multi-tiered web-based system, and all the data are accessible through a public web portal. And there are multiple tools and features on our network, and a key feature is our Data Explorer, where users can view maps, tables, and charts with environmental health data. And we also have a feature called Info by Location that provides our data in infographic form. And users also have access to our data via downloadable data sets, as well as via an application program interface, or API. Next slide, please. And we currently have 25 different sources of environmental hazard, exposure, health effects, and population characteristic data that are included on our tracking network. So again, that people can quickly and easily access this information from our tracking network. And these topic areas are selected based on factors such as availability and applicability of existing data. And we work closely with our national, state, and local partners to obtain these data. And in some of our fellows previously have even been able to share data to our tracking network. And much of these data are standardized so that they can be compared over time and space. Next slide, please. So Sam showed a very similar slide, and I wanted to just highlight this one more time, because since inception, we've been able to fund 43 fellowships, as you can see in the yellow. And several fellows are now funded state partners with the National Environmental Public Health Tracking Program. And we look forward to continue to partner with more fellows to help build capacity to be able to conduct environmental health tracking. And I'm very excited to hear about the 3 projects conducted this year. But thank you very much for your time.
Thank you for that wonderful overview, Pian. All right. Next, we'll be hearing from Dr. Anil Nair about some of the project highlights from his Pennsylvania tracking fellowship. And Dr. Nair will not be having slides, but he'll be sharing his screen with some of the data that he used for his fellowship. So Dr. Nair, I believe you have that capability on your end. So if you just hit share, then you can go ahead.
Hi, good afternoon. Can you see the slide now, or the screen? Hello?
We can, yes, thank you.
Actually, I need to explain a little bit of history. Pennsylvania Department of Health was a recipient of the PhD grant since its inception till 2017. However, we were not selected for funding in the grant cycle that started in August 2017. And as a result, all the staff members who were working on the PhD program were given jobs in other programs. Many of them, almost all of them, moved out of the bureau, leaving no staff to conduct any of the activities that the previous PhD program was performing. And but at the department level, we found that it is important for us to continue some of the activities in the interest of public health. Actually, part of the, as you know, ePhD has several indicators that are prepared for the NCDM document. And once we lost the program, some of the responsibilities were taken up by our informatics team, but they were not able to handle some of the data sets, such as the ones related to air quality, drinking water quality, and childhood platelet levels, and housing and poverty data. But we thought that these are all important factors or important areas from a public health perspective, and we decided that we would be continuing with these activities. So we thought that the PhD fellowship program would be a good opportunity for us to get trained in like analyzing the data and preparing these indicators according to the NCDM document. Basically the main...
Dr. Nair, could I please ask you to speak a little bit closer to the mic? I can hear you, but there might be some trouble for some of the others listening. Thank you.
Okay. Can you hear me now better?
It's a little bit better. If you could
okay.
adjust the volume maybe a little bit higher on your end. Thank you. Sorry about that.
Okay. The main goal of Pennsylvania Department of Health participation in the fellowship program was to have a staff member trained to continue the analysis of data on air quality, water quality, childhood and adult blood levels, and housing and poverty according to the NCDM standards, and to make summary reports available on our website for public use. So we applied for this fellowship and we were lucky to get this fellowship. And as part of the fellowship activity, we were given the opportunity to visit New York State Health Department. That was our mentor state for this purpose, and that program is managed by Mr. Neil Muscatillo, and he was very kind enough to offer all the required support for me to learn the different data sets and the procedures for analyzing them. Actually, there is a little bit history because I joined the department maybe 2 or 3 months before we lost the PhD program, and I wasn't very familiar with these data sets and the analytical procedures for creating these indicators. So he was very helpful in like explaining all these different data sets, and during the visit he explained all the PhD program activities in New York State, which was very, very helpful for me to have an understanding of the program. And even before the actual site visit, ASTHO and especially Sam was able to organize a couple of telephone calls with the New York State Department, and we explained our expectations and goals for this fellowship program. And those were all very helpful for me to move in the right direction to accomplish this task. So now let me move on to, can you still see the slide, the screen?
Yes.
Okay. So let me move on to what we did. We analyzed the data sets and submitted that to our IT department, and they placed those documents on the test system, and we re-evaluated those things for errors and other kind of cosmetic changes. And then all those data sets are now available on our website. I'm going to take you there. So they have like, we have some information about these data sets. And we have this note on the top because we are no longer having this ePhD program operating in the department. Sorry, trying to load the page. we have the air quality data published for the year 2017. The program before that got defunded was able to complete the air quality data to 2016. So we analyzed the ozone and the PM2.5 data set. Today. Yeah, this is the air quality, the number of days and percentage with maximum 8-hour average ozone concentration over the National Ambient Air Quality Standard. We had that for all the counties in Pennsylvania. The annual average ambient concentration of PM2.5 in micrograms per cubic meter based on seasonal averages and daily measurements. So here is the percent of days and number of percentage with PM2.5 level for the and moving on to the water quality analysis. We had some difficulty in getting this data set ready at the time of completion of the project because this data set was given to us by our Department of Environmental Protection. They had some staff changes and they were having some difficulty in extracting this data for us. But we were able to work with them and get the data at a later point in time and completed analysis of that, and that is now our the drinking water quality annual public water usage. So this is the analysis of contaminants in public water, and we have contaminants as indicated in the NCDM document. We have completed analysis for all these compounds. So now all of them are another data set that we analyzed was the childhood blood level. Unfortunately for Pennsylvania, we have not completed cleaning the data for 2016 and 2017. But at the time of the project, we had only the data for 2015, so we analyzed that, and we plan to complete analysis of the other data sets when they become available.
Dr. Nair, if you wouldn't mind speaking up a little bit more, I think some of the folks are having a little bit of trouble hearing you.
Let me.
Sorry, thank you.
I'm sorry about that.
That's okay. Thank you very much.
Is this better? Is this
yes,
better?
That's better. That's much
okay.
better.
So this is the childhood-lead poisoning data for the year 2015. So that gives the lead numbers for different for all the counties in the state for different levels of blood lead. We have also analyzed the adult blood lead level, even though that is not part of the NCDM document, and that was not there in the EPHD website, in the previous EPHD website, but we are working with our IT department to add that as a new item. Of course, we don't have any funding for them to develop a queryable system for that, but we are trying at least to have it as a static report on the website. Then the other data set that we analyzed was for children less than 5 years of age living in poverty. So that information is now available on the website. And another data set that we analyzed was the housing by year built in the state of Pennsylvania, and that is also now available in the website. So going forward, our plan is to have some of it, because we still don't have dedicated staff for doing this, but we are, like with existing resources, we plan to continue analyzing these critical data sets and provide that information in the interest of public health. Again, we had some limitations and difficulties during this process because all the staff members were moved to different organizations. We actually did not have the contact for the data sources, so it was a challenge at first. And now I think we have all the contact information for the people for procuring the data sets, and we think we will be able to continue this process until we get a permanent solution for this. That was the project that we did under the fellowship program. I know that it is different from the projects that are undertaken by other fellowship recipients, but we thought that this was the most important need for the environmental health program here in Pennsylvania at that point in time.
Mm-hmm. Well, thank you very much for that, Dr. Nair. It was great to see how the fellowship could really support Pennsylvania as a previously funded CDC tracking team. So we really appreciate that. And for those who might have missed it because there were some volume issues at the beginning, Dr. Nair was mentored by the CDC grantee tracking team at New York State. So I'll be switching up the order of the last two presentations. We're just having some connection issues, but we will next be hearing from, let me just stop sharing. Next, we will be hearing from Tina Echeverria, Program Manager from the Washington State Tracking Team, who will be sharing her project that was conducted with our ASTHO fellow from the Commonwealth of the Northern Mariana Islands. So Tina, I believe you're on the line. Can you see your slide?
Yes, thank you very much,
Excellent.
Sam.
You're welcome. All yours.
Okay, we're off and running. I'm speaking instead of Eileen, who was the fellow from CNMI, for a couple of reasons. One is it's Saturday in CNMI, and also they had a devastating typhoon go through this season, and so the island is very busy rebuilding. Many of the people that I met, their houses were impacted, and the buildings infrastructure was impacted. So you will see slides throughout. My background slides are of pictures of CNMI that I took when I was there. So I'm ready for the next slide. So the Commonwealth of the Northern Mariana Islands is way over in the Western Pacific, much further than Hawaii, for people who don't know where it is in the world. And their pilot project was to focus on the Zika and other arboreal-viral diseases that may show up in their territory. And as Eileen mentioned in her report, the recent circulation of the Zika and the other arboreal-viral diseases in and around the Pacific region lead them to needing to do surveillance of the mosquitoes on the island. And so even though they don't have the diseases yet, they are doing surveillance in case they show up so they can track that. Next slide, please. So the process was working with Sam at ASTHO, Eileen at CNMI, and several team members from the Washington Tracking Network to establish a peer-to-peer relationship. So to do that, we had several calls to determine what the scope of the fellowship was. And as we were speaking with Eileen, we realized it became like, well, maybe it would be a good idea if we could pursue the idea of a reverse site visit so we could interact directly with the team at CNMI and see if we can move their project forward. And so we asked ASTHO, Sam took it up to the leadership, and they were willing to facilitate a reverse site visit. So we were very excited to initiate this type of approach to working with a fellow. And as Eileen mentioned, the reverse site visit enabled Washington to see firsthand the strengths and limitations of CNMI and their infrastructure, and to help tailor a project to their specific needs and resources. Next slide, please. So the site visit consisted, instead of the 1 to 2 day normal site visit, the reverse visit was for 4 days, so we could take advantage of the extensive travel that was involved. And so what we did the first day was met with the director of the Bureau of Environmental Health and got an overview of all of their projects. And then we convened a meeting with the BEH people that we would be working with and reviewed what normally we would have done in a day or day and a half here. And in the blue outlines, you can see all the topics we covered, the information that CNMI would need if they were to become a tracking state, kind of what's involved with being a tracking territory in this case. And I covered that in the first day because really we were very interested in moving on with their project, their specific project of building a mosquito web application and to train Eileen in the use of ArcGIS, or in general GIS. Next slide, please. What we did before we, as part of our initial first day, we also met with emergency management and several other projects that were interested in seeing what they could learn from us. One of the main points that people made was that they were concerned we would come in as talking heads and tell them all about how we do things and not listen to what their needs were. So that was what inspired us to propose a reverse site visit, so we were on the same page right from the beginning. So the emergency management team showed us the state of their mapping for responding to an emergency management issue, and on the left side of the screen, we see the island of Saipan, which is the main populated island. There are 3 populated islands. And the close-up of the towns where people live. So that was the state of their management response center. And so they're moving toward a web page. They were moving toward it for this summer. I don't know. I haven't kept up with what they've accomplished, but they are moving in the direction. So with our training, that helped them further that. Next slide, please. Day 2, Lily is another a person from the Washington Tracking Network who came, and she is one of our spatial epidemiologists here. So I was taking the lead on the actual hands-on training. Before we went to CNMI, we worked with Eileen extensively on getting her data, so it was able to be uploaded into a program, and so we could move forward from that. The other person in the picture here is Jesse, who is their IT specialist, and we worked hand in hand with him every day to make everything happen. Without his presence, we wouldn't have actually succeeded in doing as much as we did. So the other issue that was raised by Eileen was that they may not be able to support ArcGIS. It's an expensive program. ASTHO provides it to fellows for a year. So they also wanted to explore freeware that would do the same types of things that ArcGIS would do. So there was parallel training with freeware and ArcGIS throughout the visit. Next slide, please. All right, so we were busy acquiring various map layers from various sources. We showed them how to do that and integrate it into their ArcGIS program or their GIS programs. They got on the upper left, there are parcel maps. And we went into Google and downloaded the wetland boundaries, CIM, and the population estimates we got from their government. And all of that was just acquired there and uploaded and ready to be viewed in their program. The other thing that's on the lower left corner is the map of the mosquito sampling sites, as we uploaded the mosquito data as well. Next slide, please. So by the end of day 2, we had successfully loaded the draft maps. The chloropleth map shows the 2016 population density estimates by the villages. And we did this, we tried to do whatever information we could for all 3 islands while we were at it, and not just Saipan. But their mosquito sampling sites are just on Saipan. And as you click on one of those dots, the black dots are the sampling sites, and a pop-up comes up with the history of all the sampling that's been done at that site, connected to their database, and currently what the most recent sampling was. Next slide, please. So then that was pretty good. We were amazed. We got that done on day 2. Day 3, we started doing the wrappers and making decisions about how they wanted their web page to look and interact. And the field team came in for that day and helped with how they would like to see it done, what kind of protocols for best practices needed to be developed in order to display the maps and the layers. And again, we did this in both in freeware and in ArcGIS. So in the afternoon, late morning, Jesse came back in and focused on the GIS functionality. There's all sorts of base layers to decide on, lots of choices. So they learned how to navigate the ArcGIS and how to develop the website that would suit their needs. Next slide, please. Day 3. Eileen was then saying, well, this is great. One thing that would be really amazing to do is to have a field sampling, something for our mobile devices. So when we're in the field, we can record what we're seeing and where we're collecting our samples. So Lily has some experience with Survey 123, so she brought that into play, and they sat with the field samplers and with Eileen and Lily to develop the field sampling app. And so they imported a spreadsheet that they could view on this app and record information in the field as they were picking up their traps. Then they collect the mosquitoes and bring those back to the lab for identification. So it's not a complete, you're done, but you have the application there to get your data recorded, your lat and longs, time, all the information. Next slide, please. We did a fake testing in the lab of the app on one of the field samplers' mobile device. And the beauty for CNMI for this is that it both stores the data on your phone or your tablet, or it can download it immediately via Wi-Fi. But if you don't have Wi-Fi connection, you can wait till you get back to the lab to download the data. So you don't have to have Wi-Fi connection in order to record the information. So the development of the application was secondary to the development of the website, but it will be an integral solution to getting data from the field to the program and to the public website quickly. So we have an almost real-time situation set up here, which is actually better than we have in Washington State. So they're kind of leading the curve now on getting this information out in real time. Next slide, please. In day 4, our final day there, we went in for a staff meeting. On the left is the staff with Lily and I. And Eileen presented to the rest of the staff for the environmental health team what was accomplished, what we attempted to do, what we actually succeeded in doing, and answered questions. Next slide, please. So almost immediately after the meeting, there was a big windstorm that took out power for the entire island. So this was not a planned test, but a great test for what would happen in an emergency situation and whether or not we could figure out how to keep working in spite of the power outage. I don't know if you can click on the little movie with Eileen and Lily or not, if that will show, but that little square in the lower left is a little movie that I took while they were working. Eileen had loaded QGIS onto her computer. She had a fully charged computer, so they were able to continue working and refining the product that was begun in the previous 3 days. Next slide, please. All right, so by the end of day 4, we had 2 applications in the final stages of development. Mosquito web page displaying population, wetlands, mosquito data with a functionality wrapper, and the Survey 123 field sampling survey for recording, storing, and analyzing field data. So what we set out to accomplish when we first went to CNMI is in the yellow, and we identified their needs, reviewed the obligations of a CDC tracking grantee, reviewed their types of data and map features and what we have on Washington Tracking Network. We created version 1 and 2 of the mosquito map, went over finding, downloading, formatting, and cleaning data tables and shapefiles from multiple sources, and learned how to use ArcGIS Desktop, ArcGIS Online, Survey 123, and QGIS. So we felt our goals were reached. That was great. But we were still going to be there for a little while. So additional work that we were asked to do and were able to do was we found a permanent solution found for shared maps and data, published ready-made maps that was completed, and their website wasn't finalized yet and up, so it wasn't live when we left, but it was all staged to go live as soon as their IT department finished developing their website. Demonstration to other programs that will be able to build upon this technology, and built the web app for mobile availability of mapping, and learned how to transfer data from electronic field forms to Office computer. Next slide, please. So in conclusion, we had with the site visit, the mentoring and training was specific to CNMI's environment, and that is what will drive this project to continue beyond this fellowship. We really set the stage for their future, and that wasn't just a ending. We accomplished what we wanted to accomplish, we're moving it forward. For DOH and for the reverse site visit, positive things for us as a mentor state was the ability to tailor the visit to specific needs and resources, the ability to work with IT staff directly, one-on-one. We experienced challenges faced by CNMI, not only technologically, but also when there are windstorms and power outages, which are frequent. We had the ability to work with additional programs that will leverage information, particularly emergency management group and the food safety programs. Food safety programs were very excited to be able to start using Survey 123 when they were doing their inspections. And by being on site, we were able to tailor the visit to their local needs, accomplished much more than we had outlined in the original agenda. And in closing, Eileen mentioned in her final report that we hope to expand the pilot beyond vector surveillance and incorporate it into all health programs, from illness, diseases, surveillance, to sanitary inspections. So thank you. That is my presentation.
Thank you so much, Tina. Thank you for sharing with us some of those really key insights and some of those really unique insights that came about as a result of the reverse site visit, and for those wonderful photos. So thank you for that. If anyone has any thanks. If anyone has any questions, I just want to remind you that you can type them into the chat box, but also I'll just open up the line for questions following our final presentation. So that leads me to our final presentation by Tim Hatch from the Alabama Department of Public Health. And Tim, I believe you're on the line, so take it away.
Thanks, Samantha. Can everybody hear me okay?
Yes, we can hear you.
Okay. Great, great. Well, I won't say save the best for last, but in fact I am the last presentation, so I will begin. What I wanted to do is kind of give you an overview of what our experience was over the last year, and of course on a positive note when I have seen that there are fellowships out there for the taking for the 2019 cycle. So I think that's something very important for those of you who may be on the line that are not a beneficiary of one of these fellowships. Hopefully the 3 presentations plus the one you're about to hear will encourage you to apply. First slide, please. So when we first heard of the fellowship here in Alabama, we were looking to see what it is that this fellowship could actually help us do. And as the first bullet says there, really from environmental public health tracking, we were starting from scratch. Years ago, there was some interest in using GIS to do some basic environmental health functions, not necessarily data tracking, but using GIS to pinpoint data on maps. GIS has come such a long way since then. It was kind of a hard sell for me as the fellow to recruit people to get them beyond the previous knowledge of what GIS and environmental health data tracking was all about. We were very, very lucky that we were assigned to the state of Florida, our neighbors to the south, who we work with a lot, especially during hurricane season. My background is in environmental health, but for the last decade I've been working in our Office of Emergency Preparedness and Response. And so knowing some of the folks down in Florida, this was a perfect match for us. We had our site visit in March, but before then what we decided to do is put some feelers out there department-wide with other bureaus and other offices that are either currently using some form of GIS or would have some tie-in to environmental health with the tracking. So we established through a few key folks here in my office a working group for tracking. It was very well attended. We did have folks from our epidemiology, our disease surveillance, our environmental health, IT, and even some of our other emergency management folks such as radiological health and our EMS or ambulance folks that did show up and participate. One of the things that this working group came up with was the fact that GIS is a specific field nowadays. It's not just, hey, someone understands data or someone can navigate a computer program. We needed to establish classifications from GIS within the Department of Health. Now, other agencies within the state, such as our Department of Transportation, Conservation, Forestry, even Education, have GIS classifications. And right now, we have people who are very well versed in GIS and the use of the Esri ArcGIS software, but there are no GIS classifications, which would require some form of formal degree in Geographical Information Service. So we have sent that up as a request through our departmental HR as well as state HR that public health needs this type of classification if we're going to be successful in utilizing this important tool. We also met and were very well received with our Fusion Center. Because of the work that I'm in with emergency management and response, we do work with our Fusion Center. They are probably the top of the pyramid when it comes to the use of GIS. So not only do we have those resources available to us with these professionals who day in and day out operate this form of data tracking, we went to them to see how is it that environmental health tracking can benefit from their expertise. And then the last bullet here, one of the big things that we're wanting to do with our work group, with our state partners, knowing that the STEP and HPP grant applications will be written here first part of 2019, and it is our understanding that it will be for a 5-year grant cycle. Environmental public health tracking is actually listed in there as one of the target outcomes, not necessarily a capability, but it's one of the things that our federal funders would like to see states focus on. This fellowship has kind of helped us spark or be that catalyst to say, okay, now we know what our federal funders are wanting in this field, and so we now have a better understanding of what it is that we need to propose for our 5-year cycle. Next slide, please. So what are some of the benefits and lessons learned, at least from the Alabama team that participated in the fellowship? Obviously, meeting with our folks down in Florida was invaluable. We could not have had a better state, so thank you for hooking us together. But one of the things that we learned quickly from our Florida partners is that establishing an environmental public health tracking network is a long, long process. They've been in it for over a decade, and for us to see the Cadillac version right off the bat was a little overwhelming, but having these good people to tell us along the way that, look, you know, it's going to take some time, be patient, due diligence pays off in the end, and as the first bullet says there, that doing this type of project is a marathon and not a sprint. So we did have a good understanding and overview of what it takes to create a successful environmental public health tracking program. We were exposed to, as the third bullet says here, the building blocks needed to establish those data sharing agreements, who to talk to, how to talk to them, and what documentation is needed, especially when those of us in the public health field understand HIPAA and what type of data can and cannot be shared. That's a little hard to explain to some law enforcement folks when a lot of times they believe that they have full access to everything. HIPAA is a different animal, so educating them on what we can and can't share was quite difficult, but I think once that was understood, we're having a lot better working relationship. Also understanding what maps can be used for, how they can help us not only understand the conditions in our communities, but also to relay that information to the decision makers, policy makers, and ultimately those who hold the purse strings. So it's a lot easier to show someone a map that's filled with data as opposed to a 15-page report that most people can't get through the introduction. And then our exposure to these experts in environmental public health tracking, not only there in Florida, but also once you're introduced to this group or this community of folks that understand data tracking. I've participated in some of the CSTE meetings, also with some national webinars, and understanding the language and being able to ask important questions or even intelligent questions is very helpful. Also seeing what was some successes and failures from Florida was very, very important. It's easy for folks to say, well, this is how we did it, this way you need to do it, but to be told why this worked or why other ways didn't work saves us as an infant program a lot of time and effort. And then being able to have the exposure to those best practices and some of the training tools that are out there, not only through ESRI, but through these other EPHT states. And then I think this is borrowing a phrase from several years ago, but learning that it does take a village, that working within your department, also outside of your department with your partners for data tracking, data collection, data sharing is key to having a successful EPHT program. All right, next slide. So I want to give you real quickly how we are sitting here almost mid-December as a program that has been, part of the fellowship for now a year. I think it was very, very, very beneficial, so thank you to ASTHO and to Sam for providing us that initial ArcGIS exposure, getting us the software that could be installed here locally on some machines to allow us to learn by doing, playing with the system, getting not only the users up to speed, but also our IT folks who not only need to learn this system from a functional standpoint, but if we're going to be doing that data sharing, how is that done from program site to program site? So that was very, very helpful. It also allowed us to see that doing an EPHT is not necessarily a inexpensive project. So knowing what costs are involved initially throughout the year and then projecting long-term expenditures for having a robust public health tracking program from the software and hardware side is important to know. So that was quite eye-opening. What we did do is, as a project goal, was to update our coastal conditions website using some more robust mapping. Prior to getting this fellowship, we had static maps that had to be uploaded and updated and very, very cumbersome, and immediately when they were uploaded, they were already out of date. So being able to link current data on current maps through a hyperlink has really made our website better. Is it in the final stages that we wanted? Absolutely not. So this was, like I said, a very small portion of the project that we did, but we were very, very glad that at least we've come forward into the 21st century with our mapping and how the public can use it with this one specific need of looking at coastal conditions. Alabama is a very high tourism state, and our 30-some miles of Gulf beaches are visited by people from all over the world, so having that asset there was really, really beneficial. We've also gone beyond the EPHT working group, and we're now establishing data sharing and environmental health tracking working groups that are going to work under the larger GIS work group that we established. So I guess these would be subgroups. We're looking at early 2019 of kicking off some quarterly meetings to set goals and objectives of what we're going to do within 2019, and then, as I said a few slides ago, looking at our FEP and HPP grants, how can we utilize the funds that we get and the projects that we propose to make our state better prepared and to make our healthcare systems more informed on the data that we have out there. We are hoping that early in 2019 we're going to have that established GIS classification or classifications. That might be a little hopeful, but at least having one GIS certified person here in the department that can make those links between divisions, as well as be able to talk to other GIS professionals in other departments within the state when we start this data sharing initiative. And then what we want to do in our grants, we do have and are expecting to purchase a full suite of the Esri GIS software, and we're going to encourage staff who would utilize this software to seek that training so that they can be better prepared when it's fully installed and we start rolling with this, because from what I've seen in the small time that I've been exposed to ArcGIS is that the learning curve on this software is very, very steep. However, once you get to know it, learn it, love it, it is a tool that I don't know how we've lived without it so long. Next slide. And then to wrap everything up, I do want to give some kudos and recommendations. As I think I mentioned before, that without this fellowship, this department would not have been encouraged to go out there and seek those data sharing agreements, get that spark or have that catalyst that says, you know what, we need to be moving forward on this and not either doing mapping and data collection the way we always have, but to really lean forward, as they say, to have this project help us form that GIS office within the department. I mentioned the Florida Department of Health. Our mentor was Mr. Chris Duclos. We've had a real good working relationship since then. As a matter of fact, Chris is coming here to Alabama as part of our annual public health conference to do a presentation on Florida's EPHT. So that not only are they hearing it from those of us who participated in the fellowship, but our mentor himself can come and share some information, because we do believe that very soon Alabama is going to be steaming ahead forward pretty quickly with our own GIS. Thank you to Sam and ASTHO for selecting us and allowing us to participate in this. I do believe that this fellowship was a worthwhile effort. I hope that it continues for many, many years. I would like to see 100% state participation. I believe that within a year or two, Alabama may, hopefully, fingers crossed, be able to apply through the CDC to be a full-fledged tracking state so that our information and our data can be shared not only across the state, across the region, but also across the country. And our goal, and I know it says 2024, seems like a long time away, but you know, we're starting in a few weeks' time to begin to write our 5-year plan for what we intend to do, mainly through FEP and HPP. But I would like to see, our goal is to have a fully functioning environmental public health tracking program by the end of that grant period. So, barring any questions, I believe this will conclude my presentation.
Thank you very much for that, Tim. Thanks for your presentation, for the glowing review of the fellowship. In the interest of time, I don't see any questions in the chat box. However, I invite you all to participate in a brief evaluation following this webinar. I believe you can click on this link in the ReadyTalk platform, but if not, you also get a follow-up email. We'd really appreciate that feedback, just to, as ASTHO really wants to continue just doing even better work. So whatever feedback you provide, we'll definitely take that into account. And just quickly, while we still have some people on the line, I wanted to make a plug that we've extended the deadline for the 2018 to 2019 Tracking Fellowship to December 14th. So that is up on ASTHO's environmental health page. There's also a link, again, on this platform, but again, just check ASTHO's website. So, I hope you're all inspired by some of the presentations that you heard today that have given you an idea of the variety of capacity building activities that can really be participated in through this fellowship project. And if you do have any questions and would like to reach out to me directly, please feel free to do that. So just in closing, I'd like to thank CDC for their ongoing support of this program, as well as the CDC mentor teams who continue to provide our great fellows every year with some wonderful assistants who host them on a site visit and who have just been very gracious and just very lovely to work with. So thank you all for participating on this webinar, and I hope everybody has a great weekend. Take care.